A new study is raising concerns about breast cancer rates in Asian American women. According to researchers at UC San Francisco, cases are rising faster than in any other racial or ethnic group in the U.S. We're joined live by Dr. Kelsey Hampton. She's the Mission Communications and Education Director at Susan G. Komen. Thank you for being with us this morning.
Thank you so much for having me, Sheila.
Yeah, so the findings here are really alarming. Can you tell us more about exactly what researchers are seeing here?
Absolutely. So, researchers have been very interested in understanding what's going on with breast cancer, especially in different populations and in younger women. And in this study, they looked at the rates of breast cancer diagnosis in Asian American women. And what they found was that the rates of diagnosis are higher for Asian American women than they are compared to other groups of women, including white women, and that they've been rising year over year. And this is very concerning because this was particularly found in women under age 50.
Mm.
And younger women, especially those age 40 and below, are especially of concern to us because most of these women are not generally getting annual screening mammograms like women age 40 and above, which means that we don't have a great way to capture early breast cancer diagnoses in these women like we do with those who are getting their annual mammogram screenings.
Yeah, that makes sense. When it comes to disparities in cancer rates, there's usually not a simple answer, but do we have any hint as to why Asian American women are experiencing this more?
The researchers have been looking into this, and there are a couple of possible explanations, including maintaining lower body weights, lower rates of smoking, lower rates of drinking in Asian American women. But the researchers in this study and some other studies that have come out recently have said pretty clearly that not all of what they're seeing can be attributed to these lifestyle factors, and that there's probably a biological difference in Asian American women and in just different groups of people in general that makes them more susceptible to breast cancer or even potentially having different outcomes.
Yeah, so when an Asian American woman hears a study like this, should you get checked earlier?
I would say that this is a great cause for conversation, not a great cause for alarm. So I think that one of the biggest things that any Asian American woman, or honestly any woman at all can do is talk to your family about your breast cancer and your cancer health history in your family, and then take that information and talk with your doctor. Talk with your doctor about the cancers that you've seen in your family, if any of your close family members has breast cancer, and talk about any of the potential risk factors or concerns that you have, because a one size fits all screening recommendation is not going to work for everyone. And I think we're seeing the data show us that it's not serving our Asian American women.
Absolutely. And what are some symptoms or signs that women should not be ignoring, no matter their age or race?
Yes, no matter your age, your race, your background, your gender, even, most people think about breast cancer as finding a suspicious lump in their breast. And that is, by and large, one of the first and most common signs. But there are other signs of breast cancer that people don't think about quite as often. This can be a change in the texture or the feel of the skin on your breast. It can be a redness or a pain or a swelling that doesn't go away in the breast area, or discharge from the nipple or an inversion of the nipple. There's a lot more information about warning signs and things to look for on Komen.org. And if anyone has any questions, I encourage them to contact our patient care center at 1-800-GO-KOMEN to get more personalized information.
Yeah, and absolutely always good to have a conversation with your doctor as well. Dr. Hampton, thank you so much for joining us for this conversation.
Thank you very much.